Can we start?
So just give me a minute. We will get the link now. Just give me a minute. So we are on live. You can start now. Thank you.
Hello. Hello friends, I'm Dr. Vicky Jain, plastic and cosmetic surgeon practicing in Mumbai. So today I'll be speaking in a brief, a very generalized topic, rhinoplasty, also called as nose job. So I'm a plastic surgeon practicing in Mumbai. So I've done my MCH plastic surgery from Sion Hospital, and I have my fellowship in cosmetic surgery from Switzerland and fellowship in laser surgery also from APSI, that is Association of Plastic Surgeons of India. So today I'll be speaking on rhinoplasty, as I told you. So rhinoplasty, also known as nose job, and I have told you about myself. So rhinoplasty is a surgery that changes the shape of the nose. The motivation for rhinoplasty may be because of change of appearance of the nose, improved breathing, or both. Rhinoplasty is more a common term used for improvement of shape of nose for cosmetic purpose. Yes, we can have septorhinoplasty also. So septorhinoplasty is for improving breathing and improving the shape of the nose. The upper portion of the structure of the nose is bone, as we see, and the lower portion is cartilage. So rhinoplasty can change both bone, cartilage, skin, and all of the threes to make sure that you get a good cosmetic look. So rhinoplasty can be performed for cosmetic or functional purposes. The surgery can be classified as primary, performed for the first time, or secondary revision, in which patient return for additional surgery to address over resection, under resection, delayed effects of skin shrink wrapping, functional problems, or other complications also, or maybe because of trauma. The patient might have secondary changes and he would like to have a revision rhinoplasty. Most common cause of revision rhinoplasty overall the world is the patient are not happy, satisfied cosmetically. Many actresses also get their rhinoplasty maybe a couple of times or maybe 3 times also because of function. The thought process that the nose should be a perfect is ideally a myth, but it is in your mind which is bothering you for a rhinoplasty. So furthermore, rhinoplasty can be performed by a external approach, that is open approach, or endonasal closed approach. Ultimately, rhinoplasty encompasses a diverse group of procedures, including the following type of technique, which I've told you. So surgeon will consider all your facial features, the skin on the nose, and what would like to be changed. If you are a candidate for surgery, your surgeon will develop a customized that this can be done for you and this cannot be done for you. So a patient who's coming along with a picture of an actor, actresses, and he says that I want this kind of picture, it becomes difficult because his body heals differently, your body heals differently, and your facial structure is different and compared to the person you want a nose of. So sometimes a part of all of your rhinoplasty is covered by insurance. So what rhinoplasty can treat? Rhinoplasty can treat nose size in relationship of facial balance, nose width at the bridge and at the side of the position of your nostrils, the nose, the nose profile with visible hump or depression on the bridge, nasal tip that is enlarged or bulbous or drooping, upturned or hooked, nostrils that are large, wide or upturned, nasal asymmetry. If you desire a more symmetrical nose, keeping in mind everyone's face is asymmetric to some degree. So my both eyes are not symmetrical. Result may be not be completely symmetrical, although the goal is to create facial balance and correct proportions. So rhinoplasty is a highly individualized procedure because no nose is same. You should do it for yourself, not to fill someone's else desire or try to fit it in someone's any sort of ideal image. because the person who wants to be happy with you will become happy not because of your face. He has to be happy with, he has to accept you the way you are. So who is a good candidate for rhinoplasty? You might be a good candidate for rhinoplasty if your facial growth is complete, you're physically and mentally healthy, you don't smoke, you have a positive outlook and a realistic goal. Realistic goal is a very important thing, because if a patient doesn't have a realistic goal and he expects a wonderful result, or maybe his life will change, that is a difficult option, because these patients are the potential litigants that can give you problems in mind of a, and so you should have realistic goals in your mind for improvement of your appearance. Consultation, what a consultation during rhinoplasty consultation, be prepared to discuss about surgical goals with regard to both appearance and breathing, medical conditions, drug allergies and previous medical treatments, current medications, vitamin, herbal supplements, alcohol, tobacco and drug use, and previous surgeries. So these all help the doctor to make you understand what can go wrong during the surgery, the prognosis and everything. So rhinoplasty surgeon might be also evaluate your general health status and pre-existing health condition or risk factors, the option available to you for your nose reshaping, examine and measure your face, take photographs, discuss your nose surgery options, recommend a course of treatment, discuss likely outcomes of nose surgery and any risk or potential complications. So rhinoplasty risk include anesthesia risk. So any surgery, this has to be done under general anesthesia. So general anesthesia is own set of complications and risk. So change in skin sensation, there may be numbness or pain, difficult breathing after surgery because there is a bigger swelling, infection. Might be a nasal septum perforation. The nasal septum is something a uh, midline a thin bone which can be perforated. So additional surgical treatment may be necessary to repair the septum, but it may be sometimes may be impossible to correct this complication. Poor wound healing or scarring, possibility of revision surgery, which is always there, skin discoloration, swelling, unsatisfactory nasal appearance. So that is the most common cause for revision rhinoplasties. So in preparing rhinoplasty surgery, you may be asked to get a lab test. We ask the patient to get a lab test done, take certain medication, adjust current medications, stop smoking, avoid aspirin, anti-inflammatory drugs, and herbal supplements that can cause increased bleeding during the surgery. Your plastic surgeon will also discuss where your procedure will be performed and what type of surgery, open or closed. Rhinoplasty may be performed in an accredited office-based surgical facility. Some people do it in their own medical facilities and small nursing home also. But I would prefer to do it in a big surgery center where ICU backup is also there. So the incision is very common. There is a inverted V incision also and a stair step incision. I prefer to do the open approach only because I have no experience in endonasal approach. It is a close approach. So what involves it involves a reshaping of the nose structure. Overtly large nose may be reduced by removing bones and cartilage. Sometimes surgery of the nose may be required. May require the additional cartilage graft. The cartilage grafts are taken up from the nasal septum itself, or maybe from the your bone your cartilage also, and sometimes from your rib cartilage also. So as I told you, septum is a rich source of cartilage, but sometimes when we require a more cartilage, it is done from your rib also. And there involves open approach where we open up, we deglove the entire nose. Once we deglove, we can see the entire internal structure. So we have to work on the dorsum of the nose, the bones of the nose. Osteotomy might be require internal and external, means medial and lateral osteotomies, and then tip work to make sure that the tip is looking perfect to your nose. So correcting a deviated septum, if the septum is deviated, it can be straightened and projections inside the nose reduced to improve breathing. So as I told you, septorhinoplasty is a part of rhinoplasty when it is required. Aftercare, after the surgery, you need to rest in the bed with your head raised higher than the chest to reduce bleeding and swelling. Your nose may be congested because of swelling and from the splint inside your nose. So we do a nasal pack for at least 24 to 48 hours to make sure that the bleeding is taken care of and the swelling is also taken care of. To further the lower chances of the bleeding and swelling, your doctor may ask you to follow the precaution for several weeks after surgery. So avoid strenuous activities such as aerobics and jogging. Take bath instead of showers while you have bandages on your nose. Don't blow your nose. Eat high fiber foods such as fruits and vegetables to avoid constipation. Constipation may cause you strain putting pressure over your surgical site. Avoid extreme facial expressions such as smiling and laughing. Brush your teeth gently to limit movement of your upper lip. wear clothes that fastened in front of fastened in the front. Don't pull clothing up such t-shirt and this thing. And if you do a osteotomy, the osteotomy fracture the nasal splint and the plaster will stay for 7 to 14 days to make sure that protection is applied. We give you some medicines to make sure that everything goes in picture. And the nose changes shape throughout your life whether you have surgery or not. For this reason, it is difficult to say when you will have to obtain your final result. As I tell you, it might be 3 to 6 months, but however most of the swelling is gone in most of the swelling is gone within a year. Thank you. Yeah.
So you can pick up the questions in the chat box.
So ideally, I don't get a lateral cephalogram done by a patient because lateral cephalogram can sometimes mislead you and unnecessarily give patient a unnecessary uh, more knowledge which is not required. So basically, when a patient comes to me, I take pictures and I ask what the patient can give. So most of the patients have a vague thought. So I give them. I can make sure that. I make sure that I tell them that yes, we can do osteotomy. We can give you a straight nose and sometimes a smaller nose or maybe a wider nose. I do not perform lateral cephalogram for the patient. It is done for cleft rhinoplasties, but I do not perform cleft rhinoplasties because they are more complicated. So, in which rhinoplasty surgical methods you prefer in a twisted nose? So, yes, open approach and go step by step. So, if the osteotomy is required, we do the osteotomy. We make sure the dorsum is made sure that it is corrected. It is straight in line, and we do septoplasty, and any internal correction has to be made, such as if there is inferior turbinate hypertrophy, we make sure that the turbinate hypertrophy is also taken care of. And if grafts are required, spreader grafts to make the nose straight in shape. And we make sure that we do the tip work to take care of the twisted nose. So at which stage you use piezo device? I do not use piezo device. It is a quite a costly device, and it is used commonly for the osteotomies to make sure that piezo device make sure that the swelling is less and the bleeding is less. But I have not any experience of using the piezo device during rhinoplasty surgery. Thank you.